How do they manage contrast allergy for CORT scans? When doctors need to use a CORT scan to look inside the body, especially for conditions like diverticulitis, they often use a special dye called contrast. This dye helps make the images clearer and more detailed. But some people have allergic reactions to this contrast dye, which can be mild or serious. Managing these allergies carefully is very important to keep patients safe while still getting the information needed for diagnosis. Before the scan, healthcare providers review the patient's medical history. They ask about any past reactions to contrast dye or other allergies, and check for conditions like asthma, kidney problems, or thyroid issues. This helps identify if the patient might be at higher risk for an allergic reaction. Knowing this allows the medical team to plan the safest approach. It's also important to tell the difference between true allergic reactions and non-allergic responses. True allergies involve the immune system and can cause symptoms like hives, itching, trouble breathing, or even a severe reaction called anaphylaxis. Non-allergic reactions might look similar but are caused by the chemical properties of the dye itself, not an immune response. Recognizing this helps doctors decide how to prevent or treat reactions. For patients with a history of allergic reactions, premedication is often used. This involves giving medications like corticosteroids, such as prednisone, and antihistamines, like diphenhydramine, hours before the scan. These medicines can reduce the chance of a reaction, especially mild ones. However, premedication does not completely eliminate the risk of more serious reactions, so careful monitoring remains essential. If a patient has had a severe reaction before, doctors might consider alternative options. They could use different types of contrast that are less likely to cause allergies, or choose imaging methods that don't require contrast at all, such as ultrasound or magnetic resonance imaging without contrast. Sometimes, switching to a different iodinated contrast agent can also help if the specific dye previously caused a reaction. During the scan, patients are closely watched. Medical staff monitor for any signs of an allergic response. If symptoms appear, the contrast is stopped immediately. Treatment may include administering fluids, antihistamines, corticosteroids, or in severe cases, epinephrine. Facilities performing these scans are equipped to handle emergencies quickly and effectively. Mild reactions like flushing or itching might only need observation or oral antihistamines. More serious reactions, such as hives, swelling, or difficulty breathing, requiring prompt intravenous treatment and supportive care. The goal is to manage reactions swiftly to prevent escalation. In the case of diverticulitis, contrast-enhanced CORT scans are very helpful for diagnosing and understanding the severity of the condition. Managing contrast allergy carefully ensures that patients can undergo these important scans without unnecessary risk. Doctors weigh the benefits of detailed imaging against the potential for allergic reactions, using premedication or alternative methods as needed. Always remember, each patient is different, and medical teams tailor their approach accordingly. If you have concerns about contrast dye allergies, it's best to discuss them with your healthcare provider, who can develop a safe plan based on your medical history.